labelling each. Later on at the end, when we have the Q&A, there may be a chance to use your microphone to ask a question that way if you prefer, but we'll see how it goes. And yeah, I'm really delighted to introduce Helen, and I have an introduction I'm going to read out actually, because there's lots of important things here. So Helen's worked in adult literacy for over 20 years and is the policy officer with the National Adult Literacy Agency, so NALA, in Ireland, writing submissions and policy papers on adult literacy, numeracy, digital literacy. And in 2020, she oversaw the development and launch of 3 key policy documents for adult literacy in Ireland, and is currently preparing NALA's submission to government on the 10-year government strategy for adult literacy, numeracy, and digital literacy. And today we're really grateful that she's here and will talk to us about these recent reports and how they're informing and influencing government policy. And in particular, she'll talk about the Literacy for Life report, which proposes a whole of government framework that would be based on a capabilities approach to go beyond focusing solely on literacy as a skill. So I know this is something really close to all of our hearts, I think, and we're very grateful to have Helen here. So I'm going to pass over to Helen.
Great, thank you, Sam. That's brilliant. And we just have to take the screen. So this is all my literacy digital learning here now. So I am going to, do you hand me over this, or can you see my screen? Not
yet at the moment.
So it just doesn't, it says to me here just on the screen that
Is it not letting you share?
No.
Okay, what I can do, Helen, is I can share my screen again, and I've got your presentation here. Should we try that, and we can do the next slide, please, thing as well. Okay, bear with me 1 second.
Right. Well, I'm delighted to be here. I'll start off anyway, and thank you for the invite to discuss and to share with you today what's happening in Ireland, which is the Literacy for Life. And I'm going to be talking a little bit, a couple of slides, and then happy as we move on, take some questions or answer anything people would like to ask. So Ireland at the minute, and I suppose maybe just have a look, these are the 3 pictures here of 3 recent reports that we produced in NALA. So NALA is the National Adult Literacy Agency. We are a charity, not-for-profit organisation working here in Ireland. We are mainly funded by the Department of Further and Higher Education, and we've around 20 staff. And a lot of our work is around supporting practice on the ground. So we would do a lot of research, we would do some training, run webinars, and also, I suppose, support. We have a whole distance learning service. So we would actually support learners to begin their learning journey with us over the telephone and online, and then eventually trying to move them into one-to-one and FaceTime classroom learning after a period. So it's sort of a lot of different, we work on a lot of different areas, with the student voice being really central to all of our work as well. So we have, over the last number of years, we work, and we'll look at this a little bit with many government departments, and we were moving on the issue, and we produced these 3 reports over the summer. And I'll be talking about these now in a moment. So thanks. If you want to move to the next slide, that'd be great. So a lot of, like everywhere in the world, I think, on the next slide, you'll see where literacy and numeracy and our definition of what that looks like. It is very interesting when we talk to many people still, they have quite a sort of a narrow view of what literacy is. And when I say literacy, we also hear numeracy and digital literacy as well. And really, literacy, as we all know, working in the sector, it's a human right, it's a social need, and it is what we use every day of our lives to function. And this diagram that we try to put together is to try and sort of share with people, for those of us that are privileged enough and have fluency in these skills, we do it automatically and forget that for people who struggle with it, they're going to find it hard to fill in a form if they walk into a public service office. They're going to find it hard to read to their child at night time if they have to do some homework with them. They may struggle with being at a social event and being asked to fill in a booklet to buy a raffle ticket. So there are many things that we all take for granted that, I think it's important to try and visualize and put that in a way to explain it to people. So we've used this visual in a lot of our work, particularly around raising awareness and aligning sort of values with employers, trade unions, community and voluntary sector, and to try and say, look, literacy is everywhere in our lives. And it isn't just about this set of skills, it's also about personal development and self-esteem building. And that is hugely important and a really essential piece. And I suppose that whole idea as well of looking at literacy from that holistic side, and that's a lot of where our research moved into then to produce the reports I'll be talking about. So the next slide then looks at literacy and inequality, because again, it's an issue that we really feel needs to be named. If we don't name it, we all might know it and assume it. It needs to be out there. So certainly we looked at the, literacy needs are intimately connected, with poverty, with poor health and social exclusion. And we have reports on this, as does the UK. We know this. And literacy is that barometer of equality. And it is linked in there with many different issues that we need to consider, and power and powerlessness and that equality. And what we struggle with in Ireland, as I think a lot of countries do, is that there's this widening gap between the people who have and the people who don't have. And again, so if you, for example, have a certificate, in Ireland, many of our initiatives for upskilling, for example, would begin to help you at a level 4 on our framework of qualifications, say 1 to 10. So we'll help you at level 4 to move up the ladder to get 5, 6 or 7. And that's fine, we need those interventions, but there wasn't as much support for people at the other levels, because again, people who want to work on literacy, it takes longer, it costs a little bit more money, it has to a little bit more creativity. So what we found was most of our investment and most of the services go to people with higher end skills, and people with lower end skills were just sort of left there. And so we are certainly, the United Nations drive and the Sustainable Development Goals, we've been really pushing that mantra that we need to invest in the furthest behind first. And that's one of our key sort of milestones when we're trying to lobby government on that. So just on the next slide, we'll share with you that in Ireland, we had a general election back in February, and that election resulted in, it took a few months, it wasn't a clear election, and it resulted in a coalition then being formed in June. Between 3 parties. And what happened then was there's a programme for government written up, and through a lot of our work and lobbying over many years, we succeeded in getting 2 sort of firm commitments. The first commitment being this new 10-year strategy for adult literacy, numeracy and digital skills, and that would be within the first year of government, which is actually quite important. So that has really pushed on the agenda. And the second piece, which is I suppose where we're still wondering where it's going to land, but it's introduce a plain English requirement. So we would have had a plain English bill going through our last Parliament, our last Dáil, that fell once the government fell. So we're really picking that up again and trying to ensure that all information that will be given to everybody should really be written and communicated in plain English. So the election was happening, we succeeded in getting that into the programme for government, and then on the next slide we'll share with you the 3 documents that we launched then just in July. So we had 3 pieces of work that we had been working on for a period of about a year, 18 months. The first one is just a sort of a state of the play report. So it's key policy practices that are happening, that are around, and the evidence of why we must invest. So quite a factual report. And these, I'm sure after the conference, the slides will be available, and the links there will bring you into the reports, but they are available on our website, which is literally nala.ie. So if you Google nala.ie and any of these 3 named reports, you will find them. So the first one, evidence-based, sort of, as I said, not opinions really, very much fact, and here's the situation at the minute. Then we moved into the second report, which was around looking at an approach. So we commissioned an organisation called TASK, which is an independent think tank for change, to work on this and to look at it. And I'll be talking a bit about the Literacy for Life now more in a minute. And that's where we recommended this whole of government approach. And then finally, we looked at sort of an outcomes framework for measuring the impact of improved literacy, numeracy, and digital literacy. And that report was written by Board Consulting. So it was Jackie Board and Daniel Sellers. So again, we commissioned that really from people who would have knowledge of that. And it's a useful report that we hope will go into the services now and into government and be taken on board when they're devising the new strategy. So on the next slide, to where I'm moving to, where we were coming from. So over the last number of years, NALA works bilaterally in parallel with many government departments. And when we actually sat back and looked at it, we were working with 9 government departments on different initiatives. So, and again, we're not statutory, we're a charity, so we would have been dipping in and out of, we would have lobbied to get a workplace basic education fund back many years ago. That would have happened and sat within the business and enterprise department, and then moved over eventually to education. We would have worked with the prison service, that would be under justice and equality. You've got financial literacy under finance, you've got children and young people under another department. Up then to digital skills were given to communications, the libraries were down in rural and community development. So as you can see, many government departments, but no sort of overarching view of this, and not a strategic approach, which we really felt was necessary, because everything that was being done was great, but there was no joined up thinking, and there was no real sort of push to say, Ireland can actually do something really big in the next number of years. Like it is a 10-year program that we need. And let's really try and cleverly and strategically put together a load of actions that we can all work on together and really make a dent into the numbers. You know, we have 1 in 6 Irish adults struggle with basic skills. And I know in the UK, you were saying it's 9 million earlier. So we're roughly at the same percentage. It's 18 million, obviously a different population size. But really it's not acceptable in terms of what COVID exposed in the last number of months was that, you know, the more literacy you had, the more resilient you were to many things. So you were taking in your health messaging and understanding it perhaps quicker. If you had good literacy skills, you were more comfortable with helping your children with their home learning. If your job was at risk, you were more comfortable with filling in a form to access employment services. So higher literacy meant you just had more resilience to cope with the pandemic. Lower literacy skills and numeracy and digital actually meant a lot of people were excluded and isolated from many of the services, many of the supports that might have been available. So we're really concerned about that widening inequality as we move into these. So we're in a lockdown at the minute, so how that looks. So we really feel that this pandemic really exposed a lot of literacy issues, and that it's a very good time to try and address and do something meaningful now. So our Literacy for Life on the next slide report came out, as I said, in July. And the purpose of this report was to provide a framework to re-examine this policy approach. So heretofore, literacy was seen as a very sort of static set of skills that you got in your earlier education years. And then, you know, if you didn't get it, it was like, oh, what do we do with you now? And of course, we know there were always programs and approaches, but really when you think of it, literacy is something we use all of our life and we never stop using it. So we're constantly learning and constantly using it. So it is really important that we look at it from a very much a life-wide perspective. And the report in particular looks at it around connecting it with the idea of resilience. So we must look at literacy in a much more holistic approach as well, that it isn't just a defined set of skills, because it has all those areas, and that's the first slide where we looked at, it has angles of personal development, self-esteem, it has personal, emotional, economic angles to it all, equality angles, systemic angles. So it's not just something we can fix quickly and it's done. So we really need to think about what literacy offers us. And it is around, when we look at how literacy gives us agency, it gives us capacity to respond, capacity to adapt, and it fits in with that sort of capabilities approach, which is really essential in what we're living through at the minute. And let's be honest, what we will live through, we still have to get past, they said this was the year of sort of trying to live with COVID. Now, next year, we're moving into vaccines and vaccine literacy. We've got climate change coming right down on us as well. And we have the next pandemic that may come to us. So there's a real case for working and improving literacy, numeracy, and digital literacy now, for a more equal, more resilient, and just a better society in general. And the three things we want and we propose in the framework is a cross-departmental and holistic approach to literacy policy. And again, this is really positive noises that we're hearing from our government side. They're very clear that the literacy framework that they're going to develop is not just about literacy for upskilling. It's not just about literacy for work. It's about literacy for life. So they're as committed to the person who will be able to work with their children and do their homework, committed to a person who might be diagnosed with diabetes today, but who will struggle with there's a lot of reading and things that you have to do, as people might be aware, if you have a diabetic plan and you have to check your bloods, that person might need some health literacy, committed to giving them that. We need to be committed to meeting people where they're at. So that is people in the workplace, and particularly low paid jobs. Every job is a skilled job. I don't like that term. They're skilled workers. Some jobs, however, are low paid, and those jobs can tend to be where people mightn't have the confidence to go further or mightn't have the qualifications or skills. So let's work with the particular sectors and upskill people for job promotion or for moving into other work. So certainly this holistic and broader approach to literacy policy is essential. The second thing we proposed in the framework was that there's a monitoring framework. So again, that's bringing everyone together, and that we would actually have it. We've done it before in Ireland, for example, on Healthy Ireland. We have a Healthy Ireland framework that brought all government departments and gave them a role in this. So we can't just be saying obviously it needs to be led by one government department, but it shouldn't be just seen as one government department. And we're drawing from those experiences of good practice to influence now what this new literacy strategy will look like. And then the final piece are we need to look at new outcomes and indicators. And that's back to what I said, that it's not just about improving literacy for work or for upskilling. It's about improving literacy for all of the other areas in our life: family, community, health and well-being, and that they are as important and should be captured somehow as well. So just on the next slide then, we just have a sort of a visual here that we were, again, when we produced this report, it was very timely because it came just after the election and after the programme for government, and while there's a new minister in. So when we went in and we said, look, we want you to take literacy and lead it in this whole of government approach. And what was great then, that he really saw that as being a way to do this. And again, we've looked at other countries. The Netherlands have done this. What they did was they brought 4 government departments together. They sat in and they did a memo of understanding. They put some money on the table from each government department, and then they walked away and said, let's implement that now. So we're taking from what other countries have done and trying to obviously place it within what will work in the Irish context. And then the final report there in the next slide just is the literacy impact. So this is very much that research report I mentioned that is around indicators of measurement. And it's a useful one. It's not sometimes, that's quite a dense report. As I say, the people who like implementation and structure pieces will probably enjoy that. But it looks at trying to look at the outcomes. So again, broadening out that literacy is just an economic issue, that it is educational, it's life-wide, it's societal and economic. And then looking at these domains. So we have 8 domains and trying to frame them, putting the learner always in the centre. Learner is key. It's all about learner-driven, learner-centred work, and that everything that we would capture then would be around these broader broader domains, and not just did a person, how many hours did someone sit down for, and what qualification did they get? I mean, that's far too narrow, because if we begin with that type of framework, then everything that's designed is to fit that, and it loses its ability to be creative and to really address this in a meaningful way, because not everyone will come back to learning just for upskilling, as we know, otherwise we would have had everybody back in. We need to approach literacy from where are you now? So where is the person? Meet the person where they're at. And another second key point and value for us is that furthest behind first that I mentioned earlier on with UNESCO. It's really important that we look for people particularly who didn't come out well of the education system, who when we invested in people in the past, they were again left there they were the hardest to reach. And we need particularly targeted interventions and integrated interventions for that group of people. So the final sort of slide then really is looking at the current status. So where are we now with all of our policy work and our lobbying work? Well, thankfully, we also landed at a new government department. So we never had a government department for further and higher education. That was created back in June as well. And the minister, after we met him, brought this sort of strategy and the time frame of 6 months, actually, he wants it written in 6 months, to the Cabinet. They have agreed. He has then asked our Further Education and Training Authority, which is named SOLAS, to develop this strategy. So we will have it in April. There's a consultation will be launched in the next couple of weeks. And then he went and set up this interdepartmental stakeholder group already. So he asked those 9 government departments and other stakeholders, we're there, employers are there, libraries are there. We sit on this group for a period of meetings until the strategy is developed. And then there will be other structures in place after that. So it is moving, and it's a very exciting period, we feel, here in Ireland, and we're taking a lot. We've always looked at what the UK has done, and Scotland and Wales, and then other countries I mentioned like the Netherlands and the Nordic countries. So we've looked at everything, and we are currently looking at what's happening and continuing to sort of build on your good practice and take ideas and share stuff, and working with these government departments really to try and support people now, because the strategy, it will not be there till April, and then we have a 10-year time frame. So it's a great time for it, but I suppose we feel it's a really essential driver. COVID has forced the hand really to say that literacy is part of what will help us succeed in getting out of this and help us become a fairer and more equal society. And so we're looking forward to working with government and lots of our stakeholders and partners over the next number of years to really try and get those numbers down to be a much smaller amount. And my details there in the last slide are there if anyone wants to contact me. And as I say, those reports are all up online, and I'm happy to answer any questions in the next session. Thank you.
That's great. Thanks so much, Helen. Some really, really interesting points about kind of taking a more joined up working approach to developing this holistic approach to improving literacy policy in Ireland as well. And I'm sure that will generate lots of questions in our Q&A. Just as a reminder, do include them in the chat box if you have them, and we'll come back to them after we hear from our next speaker as well. I can see, Shauna, you have shared your screen, which is fantastic. So just to introduce Shauna, she's a researcher at Learning and Work Institute. Shauna's going to present some findings today from a 3-year evaluation of the Tackling Multiple Disadvantage project, which was delivered in partnership with Crisis, St Mungo's and Mind. The TMD project aimed to support people experiencing homelessness, as well as multiple and complex needs to enter training or employment. And a significant proportion of participants in the programme had ESOL and basic skills needs. And so Shauna is going to talk through some of the key findings around this morning. So I'll hand across to Shauna. Thanks.
Thanks, Faye. Hi, everyone. Hope you're all enjoying the conference so far this morning. It's really great to have you all here this morning, so thanks for joining. I thought I would start by providing a bit of an overview of the session this morning. We were commissioned by Crisis to evaluate their TMD project, and the aim of today is really to share some learning from this evaluation, with a particular focus on findings around basic skills and ESOL needs. So TMD was quite a niche project. It was focused on supporting homeless people with complex needs. And some of these people had gotten support to improve skills in maths or literacy, or access to ESOL classes. But it's just important to highlight that this was not a focus of the evaluation. But I do hope that there are some key lessons and findings that will interest some of you here today. So TMD was designed to support homeless people experiencing multiple disadvantage, which meant that they were homeless and had at least one other complex need, such as addiction, health, and so on. The project was developed in response to ongoing gaps in employment support for people who were homeless with additional needs. So for example, specialist support organisations who are mainly set up as single issue support services who lacked capacity to offer kind of work-based support or links with the job centres. And also generic employment support programmes such as the work programme had very poor outcomes for homeless people. The project was designed with a coaching model, so a coach who delivered highly personalised support and linked people into services to address their individual needs kind of in the right sequence for them. They also supported access to a range of specialised support offers such as training, housing support and access to employers. This was a Building Better Opportunities project funded by the European Social Fund and the National Lottery Community Fund. So we'll just talk through the model a bit more. So TMD used a highly personalised coaching model. All partners delivered one-to-one end-to-end provision, and there were 7 stages from initial assessment through to 6 months in-work support for participants. In addition to one-to-one support from a coach, participants had access to training and activities, both in-house and through referrals. So this included literacy, functional skills, IT and ESOL classes, mainly delivered by Crisis. Participants also had access to soft skills training, as well as health and wellbeing group activities, such as one-to-one counselling. So coaches were also working with partners, for example, liaising with employment, health and voluntary sector agencies to support people with their wider needs. And participants also had access to employers, so the crisis employment platform, such as employer job fairs, were opened up to all participants. So for example, those who were being supported by Mind or St Mungo's. So just to talk through the evaluation a bit more, L&W's evaluation of TMD was designed to be both formative and summative. So in layman's terms, that means that we were sharing learning with the funders on an ongoing basis through steering groups to help them develop the service throughout the 3 years of delivery. And we were also measuring the extent to which the project achieves its aims according to the success criteria. As you can see there, outcomes included job searching, entry to education or training, and employment. We were also looking for softer employment related outcomes, which I'll come to later. So we used a range of research methods to evaluate the TMD project, and this included quarterly data analysis of information collected about participants, which we presented in a dashboard like so. We also did analysis of participants' living situations at the start and at the end to assess how housing status interrelated with other factors. We conducted a range of qualitative research, so 2 waves of research with both staff and participants. So these were longitudinal, so we were tracking people from the beginning to the end of their journey on the project. And lastly, we held a workshop with senior staff towards the end of the project to shape the recommendations. So moving on, just to look at some of the evaluation findings. Overall, TMD engaged 448 people with multiple and complex needs into the project. Their needs were highly varied, including homeless people with mental health conditions, experiencing substance misuse, health conditions, or basic skills needs, and so on. And you can see there that just over 50% of participants reported having low levels of basic skills. So, oh, I think I've missed a slide, sorry. No, I haven't, sorry. So yeah, research with coaches and participants revealed additional insights about the group of people who were engaged with the project. So firstly, most people were further away from being work or ready to work than coaches reported being used to working with. The coaches attributed this to the project being focused on multiple and complex needs rather than working with a single issue. And in practice, that required a highly individual approach to providing support and working with highly fluctuating caseloads. The evaluation also explores different needs and barriers in depth. So for example, the prevalence of mental health, offending history, but what came out strongly was that this type of support, which is truly individual in approach, is needed for multiple and complex needs as the way circumstances and kind of needs interact over time. Just to look at some of the outcomes that TMD achieved and the main lessons learned. So particularly looking at employment, TMD had a 28% entry to employment target, which was always viewed as quite ambitious when compared to projects who have supported similar target groups. However, they did achieve a 27% overall employment rate, which was very close to the target and pretty impressive. They also had a target set for sustaining employment for 6 months, which was 16% of participants. They didn't meet this target, but there are various reasons for that, which I won't go into. Sorry. And importantly, analysis of housing data showed a positive link between gaining secure housing and sustaining employment. So for example, just under 40% of people who entered employment sustained this for 6 months, but this went up to 68% for those who had also secured housing. So that's a large jump, which highlights the relationship between housing and work. The evaluation highlighted some key aspects of support delivery that worked for the target group. And this good practice has been consistently highlighted through the research that we've conducted over the last couple of years. So I'll just talk through some of the key takeaways. So the kind of holistic approach and the needs-led support was most effective way to work with the group. You just can't isolate and work with a single issue. And the one-to-one coaching model came out consistently as a key success factor of the project. This relationship helps to facilitate trust and build resilience and feelings of being valued amongst participants, which helps to kind of sustain engagement and progression on the project. The training and recreational activities, which I'll move on to soon, provided routine and kind of a sense of purpose amongst the group as well, kind of building up to being ready to volunteer or enter employment. The evaluation highlighted key challenges faced by participants. I won't go into these in much detail as that's not really the focus of this session. But the main challenge was in relation to when they experienced a change in coach. So kind of staff turnover and some elements of inconsistency. This slide summarises the recommendations that we made as a result of the research findings, which are divided into support delivery, recommendations for commissioners and recommendations for policy, in recognition that there were kind of challenges that require different solutions at different levels. I won't go into detail, but they are available in the final report, which I'll be able to share in a few weeks' time. So that was a bit of a whistle-stop tour of the 3-year evaluation of TMD. I've mentioned already that although we weren't entirely focused on evaluating the provision of ESOL courses or basic skills classes, we did pick up on a few things in the evaluation. So we will focus on these findings for a few minutes. TMD coaches reported that their highest needs participants were people experiencing homelessness alongside more than one other long-term issue. So this could include elderly participants who were homeless, had health conditions and ESOL needs, participants who were ex-offenders, homeless with health conditions, and homeless migrants with no access to benefits. So that came out quite a lot as a number of people living in London with kind of no access to public funding has increased. And and then those with low English speaking ability and substance misuse issues. People themselves often reported having a lack of experience or no qualifications or quite low levels of basic skills such as literacy, maths and digital. And many additionally had ESOL needs. We also conducted some analysis looking at people's housing status with a range of other factors, including housing status and basic skills. So over 2/3 of those who were rough sleeping lacked basic skills in comparison to 60% of those who were not rough sleeping. And there were more people who lacked basic skills than who did not in all living situations overall, except for social renters and private renters. And there were more participants who lacked basic skills than who did not in most living situations as well. So I'll move on from the number side of things now and talk through a case study which brings things to life a little bit. There is a lot of text here, but I hope that this will be useful when the presentations are shared after the conference. So DT joined the TMD project at Crisis in January 2018, having been in the UK and unable to find work for about 2 years. Originally Macedonian, he has a Bulgarian passport and he lived there prior to coming to the UK. At the point of joining Crisis, he had been homeless for a year, initially sofa surfing, and then when all options were exhausted, he ended up rough sleeping for a couple of months. He spoke very limited English, had no IT skills and no previous formal training to help him to get a job. At that point, he didn't have any UK-based working experience, which meant that employers were often reluctant to employ him, not sure of his immigration status or if they or about his kind of skills or level of English. So the TMD job coach supported him into temporary night shelter and paying for the first few weeks. Initially, the coach explained what documents are needed to work in the UK, helped him to create his first CV in English, and helped him to open a bank account. They also started working on establishing if he could apply for benefits, and after gathering more evidence with a letter from Crisis, he was awarded job seekers allowance for 6 months. So during the time when Dee was homeless and often rough sleeping, he showed immense commitment to the project by attending his one-to-one meetings with his coach, to sessions at Crisis and trainings that he was referred to externally. As a result, he completed a part-time security course, English and maths qualifications, and a few months later successfully obtained his CIA badge, so becoming a qualified security officer. And during this time, he also improved his English and IT skills, which is crucial in obtaining employment as a security officer. So TMD was quite a niche project, and I hope that case study brought to life how the project worked a little bit. So the project was focused on supporting homeless people with complex needs, and some had gotten support to improve skills in maths or literacy or accessed ESOL classes. But I just wanted to end with a few key lessons and takeaways that might resonate with some people. So basic skills and ESOL needs amongst the homeless population are highly likely to present alongside other pressing needs as well. So for example, health, addiction, housing, and so on. So if we think more broadly about ESOL and basic skills needs, just as Helen outlined earlier, to what extent are those needs discrete? And for some people, are they better met in a wider package of support, depending on the situation? Other key takeaways, the positive relationships through one-to-one coaching alongside referrals to kind of ESOL or basic skills classes was really critical for people to progress on the project. And the project also highlighted the value of working in partnership to provide that needs-led level of support. So it's really key to think about working with other organisations in practice, for example, through referrals, to support people whereby we've maybe identified a wider need. We're moving to a bit of a discussion now. So if there are other key points that you've taken away, it would be good to hear those as well. Thank you so much for listening and for your time. The final report will be published towards the end of November, so I'm more than happy to share that with anyone who's interested. Thanks very much.
Thanks very much. That was wonderful. Both presentations I found so interesting, stimulating, quite uplifting to hear about such great work. I think I have the privilege of asking the first question, if that's okay. And everyone else, please do throw in your questions using the comments, or if that's difficult, you can try the hands up thing. I just noticed that both of your presentations had this emphasis, and some people mentioned this in the chat, on a holistic approach. So whether that's about the holistic nature of literacy use across our lives, or holistic in terms of government interworking, joining up, or holistic in terms of the various challenges that are kind of intermingled. So for me, the first question for either of you really is, or both of you, what have you found are the main challenges in this holistic joined up approach? What have you learned from that that might be useful for others trying the same?
Do you want me to start? Yeah,
great. Thank you.
Yeah. I suppose that it's not a challenge on the ground really, because that's the ethos that adult literacy comes from. It's, you know, we all know the learners first when they come in, we work from where they're at. It is not just about skills, we work from a strengths model, as I'm sure yourselves do. It's not a deficit model. Let's look at what you can do, and then when we look at what the gaps are, we work on those. The confidence and self-esteem is just ingrained within the work, because it comes from that, and that is the way, thankfully, our own service here has been delivered over, you know, since it began about 30-40 years ago now. I suppose the challenge then with systems being put in place. So when you professionalize the sector, I know that's a very, you know, challenging term, but like we would have gone through years of capacity building. Tutors now can go back and get degrees in this, and we want all of that. But what comes with professionalization of the teaching side of things are a load of other mechanisms and systems like reporting that come to it. And so probably our biggest challenge has been trying to capture this personal development, holistic side of literacy in a tool that fulfills, I suppose, what are the government funding. So the ESF and the European monies and all that. So their criteria a lot of the time is you must get people from this level to this level, and to prove that it has to be a certificate, for example. So we've challenged that all along. There has been some, of course, we'd like to report that people have achieved certification. We want people to have access to accreditation. It's not a dirty word. It's not a bad process. It's empowering. It's great. Lots of learners want it. But on the other hand, we have to balance that with not losing ourselves in a teaching to the test mentality. We've done that to a good point, but I suppose to the detriment perhaps of not, in Ireland, of not ramping up the service. So it's been very much, our service has been, sure, we're great, we're helping 60,000 people. And we are great, we are helping 60,000 people, and we're delighted, and it's good. But really, in the bigger scheme of things, it's not enough. So in order to crank it up a little bit now and move on, I suppose, and looking at a whole of government approach, that's why it's really nice when you're looking at health literacy, family literacy, financial literacy. It can't all come with the accreditation tag. And thankfully, we have a minister and a government department that are not asking for that. So they're willing to look at literacy in this broader, holistic way, and provide supports for people that will not require them to have to sit for 30 hours here. Like we would have a learner, for example, I'll give you a great example. A learner rang us who works in retail, and she functions fine in her job, she's fine, but she's really struggling with percentages. So we have a distance learning service. We said fine, so we put her onto a tutor, and over the phone and online they worked with her to help her with just that intervention that she needed. And then she said, thanks very much, see you now, and off she went. That is a valid learning intervention that we need to work on how we capture. Not, God, we can't offer that because she didn't get a certificate, she didn't do whatever. So it's reporting challenges really probably would be our main issue. So we'll keep what we're doing really well locally. And then obviously we'll be working with government and reporting mechanisms around how that's captured. So I hope that answers somewhat of where we're at.
Thank you, very useful.
I can add something from the TMD perspective, if that would be helpful.
Great, thank you.
So it's thinking about kind of I think your question was around the kind of partnership working in order to provide that holistic level of support. I can speak from this project rather than the wider context, but the partnership that was established was kind of developed in order to provide that holistic level of support. So that was quite established and that worked really well. The partners could share expertise, resources, refer clients to different services in London. I suppose the main challenge with providing that level of one-to-one coaching in a holistic way with a significant number of people who all had different needs, and the main challenge was resource and kind of balancing caseloads effectively. So we did make recommendations as part of the evaluation just around kind of ensuring the caseload management is there. There's enough capacity and resource to allow people to kind of work in this way. So yeah, I think that was the main lesson and the main challenge from the TMD project itself.
Thank you, thanks. I also noted comments about the visuals. I think probably applying to both presentations, how useful those are, and definitely I want to have a look at those visuals and use them in different ways. Very incredibly useful to see the holisticness in both ways. So, Helen, now at the moment I'm thinking of your presentation where you have one visual about the literacy across our lives really, and then another about the different government departments that therefore you're working with. I think that's very powerful, looking at those two together.
Yeah, and funny on our visuals, just if you look at the one that's, if you call it the yellow one, that has there's a heart in the, so in the learner there we've reading, writing, the digital, and we've a heart in there. And it's funny, when we were designing that we were looking at it ourselves, so much of literacy helps you through your emotional and social needs, you know, and it is about relationships. So again, things that I think we all probably just take for granted because we do it so naturally that I think, you know, when we really put that in to try, and for some people, even the oral ability to try and communicate is really important. So I thought that was, it's just a really nice thing to always put in the person in the middle, but that it is so much about that personal, like we heard this morning as well from the learners, from Hannah and from Karen and Shauna's examples there for people, you know, experiencing homelessness. I think it has to be the person first, and visuals can help. Yeah, definitely, it's great.
So it's so interrelated with well-being. I found that in both your presentations, this kind of strong link with other aspects of well-being, and we can't really separate it out.
Yeah.
I don't see any more questions coming up in the chat.
I had a follow-up question, if that's okay, for us as the panel as well, and thinking about kind of the role of kind of what works and using evidence to inform kind of policy making and practice. I suppose reflecting on both of these programs of work, but more broadly as well, I suppose could anybody on the panel kind of talk about what lessons you've learned about good approaches to translating and communicating evidence about kind of what works to kind of influence policy making, but also to support practitioners to improve their own practice as well. So Helen, I know you mentioned about those visuals that are incredibly important because they distill that information, but I suppose is there any other kind of lessons, tips, tricks that you've kind of picked up on that really effectively reaches the people that we're trying to influence and also improve our practice as practitioners as well? Helen, can I go to you first?
Yeah, absolutely. And I suppose the first one, and you did it yourselves this morning in the conferences, we really try and put the student and the learner voice as a central piece. So in any of our webinars that we're trying to influence policy or share with BRAC, we've had a lovely two-part webinar series recently on literacy and learning care. And so it's the whole literacy classes are not just about someone sitting in a room with you with words or numbers or a tablet. You know, it's so much more than that. It's a relationship, first of all, with your tutor, and then it's all the care that comes from that. So we've really, I think that's so powerful, the story, the person. you know, here are we can put up slides and I can bamboozle you with statistics and that. What was my takeaway from any event that I usually go to? It's normally the personal experience that is shared. So I suppose that's one of the key things really for us is around placing that centre. So when we would go lobby politicians, for example, we would bring a learner with us, a student who would be comfortable obviously with talking about their experience. They mightn't have the, you know, have all of the stuff that they need, but that wasn't the point. The point is, let's grab the heart first and then we can share maybe some solutions and stuff about the head stuff, and that has been quite effective for us really in trying to promote literacy generally amongst, if you say, policymakers. And then really the other side, I suppose, has been piloting. So we've been, that whole thing again, like yourselves, you would find a project that might work and making it from practice to policy. So rather than deciding on a national level what might work, we try and go out and do a little bit of dirty work. Let's get our fingers in there. Let's try what that would look like. And then when we've sort of semi-believe it's a runner, then we will go back and say, let's mainstream this out a little bit more, let's run more pilots. So pilots have been, but they can be frustrating too, because sometimes you feel like you're in a mouse wheel where you're going around and another pilot. We sort of now know between UK and Scotland and Wales and Northern Ireland's experience and Ireland's, because we're the 5 closest countries English speaking with roughly the same stats, we sort of know what's working. So I'm slightly piloted out in one sense, I think that, and I'm more, that's why this, for us, it's actions. Come on, let's get the actions. And within that, there'll be innovations and pilots. But let's move and move to action points now with the learner at the centre.
Sure. And Shauna, did you have anything to add around kind of that translation and kind of getting messages out there around influencing and policy and practice?
Yeah, absolutely. I would just reinforce what Helen said around kind of having that service user voice when we are disseminating research findings in particular. And we've done that through the TMD project throughout the past couple of years. So kind of when feeding back recommendations to the actual funders and commissioners, we would have brought along people who had taken part in TMD to kind of share their story. And for this project, there were some difficulties related to kind of ESF funding rules, and we got some good feedback from the actual commissioners around. They recognised the difficulties that those restrictions placed on people being able to join the project. And for example, not having passports meant that you couldn't actually be joined onto the project. So kind of having that service user voice in those meetings face to face and really helped that, I think.
Thank you. I'm very conscious of time, and I wanted to actually not just kind of pose questions to our panel, but also for everybody that's joined today, thinking about kind of what you've learned about today. I suppose there was 2 questions we really wanted to hear from you about, and also in the chat box. And I think it links to Mark, your question around what sorts of research should national regional governments commission around adult basic skills as well. So as the first is thinking about, you know, what you've heard today, do you think that has any implications for your own practice? What are some of the key takeaways that you've got? And we've heard from a few people in the chat already. But also the second question, what kinds of research, evaluation and evidence would you like to see that would help inform and improve kind of your work and your practice, but also start to support influencing around policy as well? So if anybody's got any ideas across there. We're also going to just in the chat box as well, Shauna, thank you, if you could, we can post the link that will be available so that you can direct yourselves back to the main plenary session. So obviously we're going to be hearing from our ministerial address, and Gillian Keegan will be speaking at 12:15 as well. But I'd really love to hear if anybody does have any thoughts around that. I mean, Helen, could you start us off, sorry not to go back to panel as well, about kind of gaps in research or evidence that you want to see more of? So whilst we know there's a plethora of things that are going on at the moment, is there anything that still remains a real gap for your work?
Yeah, absolutely. I mean, like yourselves, the OECD PIAC, the Programme for International Adult Competencies, that lovely acronym, only happens, I mean, it happened in the results of 2013, which we use. COVID has delayed it now, I think, for about a year, so we're not going to have results till 2023. So there's certainly a national need for more literacy surveys to know where we stand in between that 10-year gap. So that's one piece. The second is the PIAC, and it's great, it gives us a state of play at the time. It doesn't go into what the literacy levels are of particular communities. And I'm thinking of marginalised communities here. So for in Ireland, we would have traveller and Roma communities, you know, people with disabilities, lone parents, people experiencing homelessness, incarcerated persons. Like we know who these groups are. So I think we would be certainly looking in the strategy for getting some more research, specific research done with particular target groups. And equally asking them, what do you want? Like here, nationally, it's very difficult to design and dream up what you think a person might want. So part of the work and part of our research that we're trying to do at the minute, and we'll be suggesting to the government, is we need to talk to adults who have literacy, numeracy needs, but have never come into the service. Now, how we would to try find them as well, but you know, and then if we can work out what and meet them where they're at. So if it's a parent, let's meet them in the school if they're struggling with supporting homework. I still believe there's an initiative that's needed on week 12 in the maternity hospitals on your scan. There is a need for a literacy person standing in the foyer when we can again to talk to people going in around how is everything going with the reading, and particularly around your pregnancy. Because even reading food labels, people will struggle. If you're struggling with that and sugar contents, there's a lot. And I think if we can, like I always say this, no person and no man or woman brings a child into the world and hopes they will struggle with literacy at 8, you know. So we need to go back and invest in the adult, expecting the child. So for me, there was always a nice piece of, probably that's more an action research piece. So it's been innovative, creative, but let's get a bit of more information about the people that we really want to help here in Ireland. That's where our gaps are.
Sure. Any thoughts from you, Sam, at all around kind of gaps, or is it just about bringing the evidence base together? You're on mute, sorry.
It's me. Yeah, my thoughts are very, very similar to Helen's, actually. I was really pleased to hear Helen say that. Yeah, I don't think we know enough really about people's needs, and I think there's a lot of assumptions made by some people up here that they think people down here need X, Y, and Z, and do they, and why, and what is really needed. So yeah, I'm quite interested in that. I also just think the idea of evidence is quite complicated though, and often the evidence, I mean, we also heard earlier how the personal stories for us practitioners can be the most useful, but they sometimes are the things that will convince governments least in terms of funding. But I mean, that's just one of those things we need to keep thinking about. Yeah.
Sure, brilliant. Thank you so much, everybody, for your contributions as well. It's a really interesting session. Unfortunately, we never have enough time to kind of explore lots of things that have come up today in more detail. The slides will be available afterwards. We understand that our LNW events team will be in touch with everybody as well. The session's kind of coming to an end now. You'll see that there is a QR code here. You can use that to re-enter the main plenary session where we'll hear from the Minister's address. Otherwise, Shauna has popped that into the chat as well. But thank you, everybody, so much for joining. It's been a really, really interesting session. And yes, we'll see you back in the plenary by 12:15, if that's okay with everybody. But thanks so much. Thank you.
Thanks, everyone.
Thanks, everyone.